So, thank you so much for coming on. And I want you to introduce yourself, your beautiful self, your brilliant self to our audience and tell us who you are and what you do.
Hi, I'm Alex Herrera, and I'm a local art therapist, board certified art therapist, and licensed professional counselor. And I have two different businesses located in Fairfax City in Virginia. One is Everyone Therapy, and that's the private practice for mental health services where we have lots of different things going on there. So I'm sure we'll touch on that later. And Redbird Retreats, which is our more holistic sister side business, looking at the full body and how we can heal and just be better and do better and feel more present and calm and relaxed in our daily life.
Thank you. So, Alex, I
Mhm.
know we've talked before. And so, one of the things of, being a licensed professional counselor, I think we've been trained. I know we've been trained to like do talk therapy. And I think a lot of times when I bring up like art therapy, people are like, what? That's something you can do. Can you tell us a little bit about art therapy and the power behind it and just how you got into it, right? Like what was that for you?
Sure. So getting into it, in my senior year of high school, I was allowed to take classes at the local university. So that's kind of when I discovered psychology, but it was
Okay.
late. It was late. So I was already going Carnegie Mellon for fine arts. So I did that program and I still loved art and I still loved psychology and therapy
Right.
when I was done. So I came down, moved to DC, had a couple jobs and realized GW had an art therapy program and started to explore it. And I thought this is a really powerful way to meet people where they are, give
Right.
them resources, help make change without that, stereotypical viewpoint of what talk therapy is, right?
Right.
So, so to me, I mean, art therapy, I could talk forever on this topic, but it's a different way to meet your client where they're functioning. And
Right.
yes, we can incorporate talk therapy into it. So, we have every therapist, I think, also includes CBT into their approach, and it has a person-centered approach. So we have those therapeutic approaches that we bring in that are more traditional, but we'll also use the art therapy to connect and to build rapport and to improve problem solving, and maybe it's focus or just even helping a client have like a meaningful way to express themselves without words.
Yes.
A lot of times the art speaks for them. And then from there, I mean, it can branch off into so many different goals or ways to help a client, like even from how to complete something in a sequential manner that makes sense, right? Or how to work with an error or mistake and make it work. There's so many different ways you can use art in the process, and it's not just for kids, it's for everybody. So we adapt it for every client that comes in front of us, and the same thing with age and need. So whatever you bring in, we will find something that works for you.
So I know a lot of times people think like, well, do I have to be an artist, right, to do art therapy, right? And so I want the expert to answer that question
Right,
because
right.
I'm not the expert in that space. Could you answer like, do you have to be an artist to go to art therapy?
Absolutely not. As long as you can be present and try, that's all you need to do.
Okay.
You might not even need to be able to hold a pencil and we'll still be able to work with you in art therapy.
Okay.
So no, you don't have to be an artist to come in. It's just about more about the process and then
Huh.
going through that work in that space with the client.
Right. And so I know that you've served in different capacities in your private practice and you're growing it and you have different clinicians there. And so I guess my question would be, you said it's all ages and I think just I'm thinking about a client that may be like, "Hey, I'm interested." Right? What would be some things that you would help them like try it or a consultation, just kind of going into that space because I think that when I think about mainstream society or just mainstream, nope, many people are not talking about art therapy or expressive
Right.
therapies, right? It's really, hey, let's sit down, I'll get calls and be like, yeah, CBT. And I'm like, I get it, right? I understand.
Mhm.
But if somebody's interested as they're hearing us talk about it, what would be some things that you would want them to think about or just thinking about, say they're interested in like reaching out to you, to the practice, but they're hesitant. What would be some things to kind of ease them through that transition for them?
Right. So we tell this to every client, whether they're coming in for talk therapy, art therapy, EMDR, DBT, whatever it is. We want you to use the first 3 to 4 sessions to see how it feels and to see if you feel like you have rapport, regardless. Because we'll also work with you if that match isn't correct to find the right match within the practice. Then the next step is I always ask, whether it's a phone call or an email, just give me a little brief reason of why you're reaching out right now, what your needs are. So then, one, I help kind of get you on the right path to find the right therapeutic match, hopefully the first time. But also, I always ask if you are interested in art therapy, too, in that question. So it's, would you be interested and would you be willing to try? And then most people, I explain to them, like, this is how we can incorporate it. This is how it could be used. I mean, sometimes it's just doodling, just to give your mind and your hands something to do while you're maybe talking or thinking through something, and it takes that pressure off. And that's one of the, I would say, a big part of the art therapy that's different, because it takes that pressure off, that one-to-one. You have to talk, you have to say something, you have to do something. You can put it on the paper or on the mask or in the paint, whatever it is you're working with. So from there, then I might go into more specifics. So if you're dealing with ADHD, I might explain how some of the executive functioning can be targeted with art therapy, for instance. And then we say, give it a try, and
Yeah.
then we'll work with you at that point too.
Okay. That's
Mhm.
amazing. I like that. Just kind of, I think it's really important for people. Something is the 4 or 5 sessions, right? Let's try it out. Try that on. How does it fit? What does that look like? I think that's really important. And a lot of people, when they're coming into therapy, they don't give themselves that grace. They think it's supposed to be a good fit. But something I kind of tell people is kind of like, hey, whatever you've been dealing with a lot of times, it's been there for a while. So you have
Right.
to give yourself time, your body to connect, to understand what it's going through. So I like that. And just even the explanation of what art therapy is, or they're interested in it. And then even just kind of, what does that look like? Just being able to witness and notice how they're feeling in that space. I think that's a really good, like, just really good thoughts to like navigate that space if they wanted to, reach out to your practice and thinking about the different expressive therapies and things that you offer. So my question, I know that you said that you have another business, and I want you to tell us all about that. Like, what do you do? I know there's two of you guys. And so I
Mhm.
want you to talk. I know you were talking about mindfulness, hypnosis, just like that, as you're cultivating that. How did you go into that? And I know like art therapy it's a modality, and I know that what you're doing on this side, it's part of that, right? There's
Right.
still right. So tell me a little bit about how you got into that and what that's been like for you.
Sure, sure. So Redbird Retreats has been an idea for a very long time that finally came into fruition about a year and a half, 2 years ago. Jennifer Dodson, who's also one of the therapists at Everwin, partners with me at Redbird, and we hold sessions together, usually monthly right now. But it kind of came from, I think, just years of collecting tools and techniques and doing tapping and grounding and more trauma-based work where we're working with the body and how it's responding, and then noticing how elevated so many of our clients are when they come into the session.
Yeah.
They might be ready for therapy, but their bodies are responding very differently. And so I'm like, okay, I want to heal the mind and the body. I'm also very interested in things like hiking and working out and Spartan races. So I'm like, how do I incorporate both of those things together, which are both passions? And that's where Redbird came from. So at Redbird, we look at you with a therapeutic scope. It's not therapy, but with that lens. And then we combine restorative yoga, which I'm trained in, and both Jennifer and I are trained in sound healing. So right now we have hour-long mini sessions that are targeted for the nervous system and bringing it down to a nice calm state. I mean, we want you to snore, we want you to fall asleep, we want you to feel like you can barely get up when you walk out. So those we're running right now, and then as we go on, we're going to be incorporating more art as therapy, mindful walking and meditation. And then in the sessions currently, like you said, I do incorporate some of that mindful hypnosis. I'm not hypnotizing anybody though. Not doing that. I'm just bringing some of the techniques that will, help you get into a deeper state of relaxation. So that just so that wording's there.
Yeah. No, I think and I when I think about just overall healing, I think it really is what you're talking about in both practices in both businesses is how to like relax your nervous system so
Mhm.
you can clear the things that might be blocked. Either your body just releases it or you may get a notice of what it is so you can understand it and release it consciously.
Right.
And so I think that's so amazing. I think sometimes people go into spaces. I like when you said it has you have a therapeutic lens, but it's not therapy. That's big. I think that sometimes people go into spaces like that, right? Into the retreat spaces, into the spaces of sound healing and think it's therapy. But I think I really like how you hone in is we come from a therapeutic lens and we're just trying to we're trying to like really relax your nervous system and so much stored in your nervous system, in your connective tissue and your fascia. There's a story,
Right.
like your body keeps a score. And so I think that's amazing what you're doing on that end. I think that's
Mhm.
pretty dope. Um, and just mindfulness walking, I don't think people understand the power in that.
It's amazing. I've done it myself. And I mean, because we talk about this a lot at everyone, just that disconnect even from the mind and body and how much the body is storing and responding, and people aren't even aware of it.
Yeah. Yeah.
So I mean, I lead residents in groups constantly, and that's something I talk about all the time. Do meditative, mindful walking. Have them even do it walk and talk therapy. We can do it from our office space,
Right.
and practice those skills. And even with Redbird, those skills, some of them can go home with it.
Hmm.
Just a few of the positions that we've done, you can easily translate that to home 10 minutes before you go to bed or at lunchtime, whenever you need it
Right.
to help relax the system.
Yeah. So where do you, because I love both of these businesses and what you have going on. Like, where does Alex eventually want to be? Like, what does wellness look like for Alex and a business and a practitioner and a healer? Like, what does that look like for you? Just like as you're
Right.
evolving, because what I think is amazing and what I think a lot of people, I don't know if a lot of people really, when they're searching for therapists, searching for practitioners, healers, of how much do they train or how much are they in it themselves, it's really important. And what I'm loving that you're saying is like I get trained. You're constantly in that space of this is for me too. This is for me, but this is also how do I bring this to the greater community. And so what would be, where are you going? Where do you think wellness is going and what you've seen as a clinician, as a supervisor, and then as a healer, a practitioner, right? Like in the spaces, how do you see wellness kind of evolving as we are in these days and things are, let's just talk
Right.
about Fairfax County, right? Like,
Right.
yeah,
Well, it's high stress around here normally, and I think even more in the last few months. So, I mean, ideally, I would love to bring this even into Everwin and have some of my therapists do more with it.
right,
I give them some of the skills, but even some of the trainings, because
right,
I think that would help our clients not just in the hour
yeah,
once a week, but every other hour
yeah,
outside of therapy as well. And easy meet you where you are techniques too that aren't, I've got to go and do this and I got to do these worksheets and
yeah,
something that people want to do. Because
right,
I do think we're in this era of wellness and people wanting to engage in those, processes and techniques, but it's also finding the time to do them.
yeah,
So finding things that work for people so they can do it everywhere else, and
hmm,
then also helping people give themselves space and the okay to come to a session like this, right?
yes,
And I mean, Redbird, I have huge ideas for going. Eventually, I want like a whole location and a site, and we're gonna have lodges and yurts and whatever else we want there, so we can do this more often and frequently, and it be more accessible to people.
yeah,
On top of that, of accessibility, we want to also reach out to specific populations. So start doing like a grief specific restorative yoga and sound healing session, or for first responders, or for mental health and healthcare professionals, so that some of these helpers out there are also getting help and their needs met. Because we love to fix and do for
yes,
others.
yes, yes,
So
yes.
that's I would love to see that more, and then building a community that way
Mm,
and reaching out into our own
yeah,
community, so that there is somewhere where people know they can go for that
yeah.
kind of assistance and support.
Yeah. No, I think that's so big. I think that COVID, we created a community. There was a community because we all were like on the same page. We were all home one way or another. But then I think when we like came back into, then I think the community went somewhere else in a way that we got to go find it again. We have to, and
Mhm.
it looks different because I think people discover things about themselves that they
Mhm.
didn't know. And I think what is so big now is that community is what's going to get us to that space of balance, like reaching out and touch community, right? I think sometimes virtual is cool and it's good, but then I think we need to let me give you a hug. Let me sit down and like feel your frequency next to me,
Right.
because my frequency this way is different than when I come and I sit with you and I have coffee or tea.
Really.
You know,
Hmm.
so I really like the idea of community and even helping the helpers because right, their third eye is open, they're digesting everything, and then it's like compassion fatigue is real.
Right.
And so I love that. I love just where you see wellness going and where you want to take it, with all the hats that you wear.
Yeah.
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 With all the hats that you wear. Yeah.
I would love for Redbird to really take off so that
Yeah.
we can offer more, more sessions, more opportunities, kind of start the expanding more.
Yeah.
That would be amazing.
Yeah.
That's the goal.
Okay. So my question would be, so you've dropped so many gems through this call and this conversation. What would be one thing that you would want the listener to walk away with? If they didn't hear anything else and they just were like plugging into this, what would be one thing that you would want them to take away for today?
That's a good question. That's a good question. I mean, of resources.
Okay.
I want somebody to know that it is accessible
Mm.
and that we are easy to talk to. I mean, most likely you're going to be interfacing with me, actually. And I give everybody a call back, regardless of whether we have appointments or not. And I think that's something I hear so many times is clients saying, thank you for just answering the phone or giving me a call back. So I want to be able to provide resources and then also know that you are going to get at least a call or attention that you need. And sometimes I'm just actually giving you resources to something else. I've had people call for one thing and I'm like, that's not really us, or I think this would be better for you. And I've gone online and helped them find
Mm.
those
Yeah.
connections that they need for services or whatever opportunity it is. So that's the biggest thing is we are here, we're accessible, and we want to help. I mean, I have a really passionate team. So I'm really grateful because it's taken years and we are just one really well functioning unit and they're fabulous. They do the hard work with the clients. So
Well, I think that comes from their passionate leader, their passionate super. I think that comes from you. I think that from what I'm hearing and even us talking before, you don't stop, right? And I'm not saying like you're going, but what I'm saying is that you have this desire to learn, to what are some solutions? How do I meet people where they are? Because for you to start the other company in the retreat space, that's big because you realize, hey, this is something we're doing over here in the practice, but what else can we do over here? And so that's one thing that I think you probably really, I guess it really is seen in the practice with the clinicians that you have, right? Because of
mhm,
you. And so I want to say thank you because a lot of times people don't give resources. This is mine and they're territorial, but there's so much out there that I think a lot of people don't know. And I love to hear that, hey, let me help you with these resources, even if you don't come to us and you're helping them in a way that a lot of times they probably wouldn't have gotten that help in the first place, right? If they didn't make that call. And
right,
so I think it really comes from you and it's top down, and you've done a good job of the reason that you have those type of clinicians is because of you.
well,
So
thank you.
I want to
I really
thank
appreciate
you,
that.
pat you on the back for the passion and being able to find other passionate clinicians to do this work and you see them. And so that is really big. Um, I know we're going to put your information. So if you want to get in contact with Alex, you can just look down below. And is there anything else that you want to share before we go?
I'm hoping this reaches a lot of people who just will at least come in and ask questions, whether
Okay.
it's about Brightbird or Everwin. And I'm hoping that we will be able to, especially Brightbird,
Yeah.
branch out to meeting other people through this and bring in their expertise as well. Because even through both practices, I mean, we have at Everyone a huge list of referrals
Mhm.
resources. They might do the same thing as us, then they might not. So even if it's just somebody contacting me saying, "Hey, I do this. Can we talk?" That
Right.
would be awesome
Yes.
too.
Amazing.
Yeah.
Well, thank you, Alex. I appreciate you giving me some of your time. And make sure you have a wonderful day.
Thank you. I'll see you soon.